The Minister of Health, Honorable Lillian Boyce, has revealed the reason for the delay in the construction of the new hospitals in Grand Turk and Providenciales. Negotiations with developers, proper accredited staff, and budgeting were all discussed in our recent interview with the minister.
The hospital project is still progressing, and if you visit the site, you will see that we already have containers that we're making ready. Johnston is making ready for the office and different areas of construction, safekeeping and so forth that they would be using on the site. But the project is progressing not as quick as we would like it to, but I want to assure our general public that the hospital deal would be wrapped up very shortly, and they would begin to see the progress of the construction taking place.
Honorable Boyce revealed that the 30-bed facility of Providenciales will feature many amenities that, according to the minister, will be able to facilitate the growing population of the Turks and Caicos Islands.
It is unfortunate that so much work and negotiation had to be done, but however, we're near closing. And just bear with us, because we are making sure that you, the people, that we negotiate and provide for you the very best hospitals both in the two islands, Providenciales and Grand Turk, and indeed the entire Turks and Caicos.
Dr. Rufus Ewing is the Director of Medical Services for the country, and according to him, an attempt is being made to get all medical providers accredited at an international level. Ewing revealed that there are some stipulations in this process.
But it really has to do with the total package, and we're dealing with all aspects of a hospital, not just building a hospital, we're developing the health system. We have to develop the clinical services in terms of what kind of service we'll be providing at the hospitals, the type of specialties and subspecialties we'll provide. We have to look at the staffing and the staffing strategies. We need to look at the financing mechanisms. We have to look at the operators in terms of who will be operating the hospitals. So most of those issues we've dealt with already. So we have dealt with in terms of have wrapped up the type of services that we're providing, the hospital design.
Among those services are the ones the hospital currently provides: chemotherapy services, advanced intensive care unit, and neonatal care.
So all in all, we will expand on the services expand and improve on the services that we currently offer, as well as introduce new services. And we hope that all of these services in the hospitals will be internationally accredited within at least 2 years of operation. And we already started the process of seeking for accreditation, because we already applied to the Canadian Council on Health Services accreditation to ensure that our hospitals are accredited. And the persons who will be operating the hospital on a contractual basis are contractually obligated to ensure that healthcare is provided at a certain standard and to be accredited.
Health insurance is another avenue that the Ministry of Health is attempting to tackle when the new hospital is open. This part of the interview will be aired in another newscast.